Mark Poole here wanted to discuss what causes AFib, atrial fibrillation, where the atria fibrillate or shake and there's an irregular heartbeat. Well, the answer is, I don't know. And indeed, the cause of AFib is oftentimes unknown, but conceptually the way I think about it is that there are special cells in your heart which can create electricity. Putting it that way, I never realized that till I went to medical school, but that's what an EKG shows. An electrocardiogram is a tracing of the electrical signal as it moves through your heart. That electrical signal, the electricity, starts in the sinoatrial node. It's a collection of tissues near a sinus, an open area near the heart where the right atrium is. This sinoatrial node, that sets out a sinus rhythm. So if you've ever heard of that, it's a normal rhythm. That's where it starts. Well, that electricity passes through the atrium to the AV node, which is the atrioventricular node. It's like an amplifier. It catches the signal, boosts it up to the ventricles, which then stimulates the ventricular muscle to contract, and you get a nice regular contraction and a nice EKG sinus appearing tracing. That's how it's supposed to work, or how it works in a normal state. With AFib, there is an interruption in that pathway, either before or after the AV node, where those normal sinoatrial sinus signals can't get through. There are other cells in the atria which will create electricity if they have to in order to keep you from dying. And so those abnormal, what we call aberrant signals begin to get through. Those can reach the ventricles at different times and cause irregularity. Why would there be an interruption in these signals? Well, that's where the causes of AFib come in. It could be just from high blood pressure. It could be from a problem with one of the heart valves. It could be because of blockages in the arteries of the heart. And indeed, oftentimes, it's not clear what is actually causing the AFib. It is possible to have AFib and have nothing else seem or apparently wrong with your heart. So, when it comes to AFib, we want to get rid of those aberrant signals to help the normal sinus signals get back on track. That's what an ablation can do. So be sure to check out my video about ablation and continue to learn more about AFib. Thanks and God bless.